Mayor de Blasio giving an update on coronavirus in New York City. Let's go to that now.
For the first time in 13 months, one of our most cherished cultural institutions, the Brooklyn Academy of Music, BAM. BAM had its first live performance in 13 months at the skating rink in Prospect Park. It was just beautiful, amazing performance. A performance by a troupe from Montreal. The group is called Le Patin Libre. It's an amazing use of skating as a form of dance, as a form of expression, and the energy and the excitement of everyone who was there, seeing our cultural life come back, seeing on a beautiful spring evening, live performance again. And it was done beautifully. Everything was safe and carefully handled by BAM, and everyone at Prospect Park thanked them. I thank them for that. But look, everyone, this is how we come back. This is what a recovery for all of us means, to have our cultural life back, to have the things that we feel and we care about that mean so much to us. And I want to thank the performers. I want to thank everyone at BAM, because this is so important to the recovery of this city. So really magical performance. Anyone who's able, I urge you to go. It's something very, very special. And today we're going to be able to share, thankfully, a lot of good news. This morning's briefing is filled with some really good updates, and first and foremost, our continued progress on vaccination. So, as you know, last week, over 500,000 vaccinations in New York City. Last Friday, over 100,000 in one day. Supply finally starting to come in. So the numbers are really moving now. So since the very beginning, there have been 4,673,627 vaccinations in New York City. More vaccinations than there are people in the state of Louisiana altogether. So I love seeing this progress. We're well on our way to the goal, 5 million fully vaccinated adults in New York City by June. And we're going to keep doing more and more to reach every New Yorker, to address disparity, to give people trust in the system. And that really, to me, is about grassroots sites. These pop-up sites have been incredibly helpful. So we're announcing a group of additional pop-up sites all over the city. And these are sites that community members know, that they believe in, they feel a connection to, and is having a huge impact. Sites in public housing, at community centers, at senior centers, sites in houses of worship, sites in community organizations that are known and trusted. It's making a huge difference. So this is the shape of things to come. As we're finally getting the supply we need, more and more of these grassroots sites reaching deeper and deeper into communities, and the numbers are just going to keep going up and up and up. Now, definitely more good news from the state legislature, and I want to just thank Majority Leader Andrea Stewart-Cousins in the State Senate, Speaker Carl Hastie in the State Assembly. They have done remarkable work with the state budget. This is the best state budget we've ever seen for New York City and for the whole state of New York. It's absolutely the best ever. And I got to tell you, the legislature provided tremendous leadership, and what they did was they created a budget that puts working people first. They created a budget that actually was based on what the legislators were hearing from the grassroots and what people needed. It was dramatic, the difference that we have seen because of the leadership of the legislature. So what have we gotten? For the first time in years and years and years, justice for our public school kids, for our public school parents. The campaign for fiscal equity case from almost 2 decades ago, ignored by numerous governors. Finally, we see the fairness in funding for New York City public schools being locked into this budget. And our kids are going to benefit over the next years in a way that they've deserved for a long, long time, but it couldn't be more timely. Because we have to bring our schools back next year after everything we've been through COVID. We have to have an extraordinary year academically. We have to do extraordinary work to help kids with their emotional challenges, and we're going to need a lot of resources to do it. This state budget helps us make that happen. Tremendous progress on a number of fronts, expanding access to childcare, addressing the real needs of renters who have been through so much in this crisis. helping small businesses, helping them get back on their feet and survive COVID. Extraordinary efforts all around, major recognition of people who need the help, including those fellow New Yorkers who are undocumented. The state legislature did something extraordinary here. And the people in New York City are going to benefit not just this year, but for years to come because of the actions in this budget. So this is really something to celebrate. And unquestionably, when I talk about recovery for all of us, this is one of the ways it's going to happen, because we got a stimulus from Washington, thanks to President Biden, Speaker Pelosi, Majority Leader Chuck Schumer. We got a stimulus that actually was what we needed to recover. Now our state legislature comes forward with an amazing package of support for New York City. This is giving us what we need for a recovery for all of us. Okay, now let's talk about all of us, because this is important. And this is a tough topic, but one where we're going to do more and more to address the needs of a lot of New Yorkers who are still suffering from COVID. And when we say all of us, it means not forgetting that even though a number of people had COVID and the disease in the first instance passed, a lot of New Yorkers are still feeling the effects of COVID months and months later. And we've got to help them. We've got to make sure that folks who are still experiencing negative symptoms, having really tough after effects of COVID, that we're there for them. And just like everything else with COVID, we see tremendous disparities. That folks who are feeling these after effects are particularly feeling it in communities that have been suffering the most. In immigrant communities, in communities of color, in lower income communities, the places where COVID hit hardest, people are feeling these effects the longest. We've got to keep working to help everyone who needs ongoing help. And that's why we created our COVID Centers of Excellence. These are centers focused on holistic care for folks who are going to need it for months and even years ahead. And there's 2 open already, Tremont in the Bronx, Roosevelt in Queens, the Bushwick site in Brooklyn coming in July, specifically focused on the hardest hit communities. And we want to provide help to all New Yorkers who are experiencing this need. So today we're announcing something very important, an Aftercare Program for folks who are still suffering. Our extraordinary Test and Trace Corps has really done miraculous work, reaching all over the city, helping people, stopping the spread of the disease, but also helping people with all of their needs, physical and mental health care needs, food, all sorts of support. And so Test and Trace is exactly the right place to turn for the ongoing care that's going to be needed for New Yorkers who are still suffering. I want you to hear about this initiative. It's so important, and our central message today is we're going to be there with our fellow New Yorkers for as long as it takes. And leading this effort, and she's done a fantastic job leading the Take Care initiative of Test and Trace, which has helped so many people to safely separate, so many families to be safe, so many people to feel loved and supported, even as they were going through COVID. My pleasure to introduce Dr. Amanda Johnson.
Thank you very much, Mr. Mayor, and good morning, New Yorkers. Today it's with great pride that I tell you about a new resource being offered by the New York City Test and Trace Corps' Take Care program to help those who are now living with the effects of long COVID. As you may have heard, long COVID is a collection of symptoms that develops either during or following a period of confirmed or a suspected case of COVID-19 and can continue for weeks and even months afterward. It's estimated that at least 10% of individuals who have been infected with COVID-19 will go on to develop long COVID. I may have mentioned this before, but even before there was the COVID-19 pandemic, I've been a primary care doctor working at a community health center based in Harlem. April of 2021 looks very different than April of 2020 did, but not a week goes by that my patients are not touched and affected by the long-lasting impacts of COVID-19. I have individuals who are months out from their acute infection of COVID-19 and are still stricken with shortness of breath, chest discomfort, with lightheadedness, with cough, anxiety, depression, confusion that they didn't have before their infection. Things that were taken for granted before they became infected with COVID-19, like showering, getting up to go to the bathroom, dressing, preparing meals, leave them exhausted. Many work in jobs that require quite a bit of physical labor, as can be expected, and they worry about what it would be like to go back to work while they're still feeling so ill. And at the same time, they are incredibly scared of what will happen to them if they don't go back to work. For that reason, we are bringing you the Aftercare program as part of Test and Trace, because I know that my patients don't represent a unique experience, and this is happening in thousands of households across New York. So Aftercare connects Test and Trace clients who have ongoing health and social needs to a full range of resources and referrals related to long COVID. This program starts today. We're going to be reaching out to a group of former Test and Trace COVID-19 cases who indicated that they were still experiencing symptoms toward the end of their isolation period. And through text messaging, we're going to be connecting them to a wide range of resources to support them in their experience with long COVID. These resources fall into 4 primary categories: physical health, mental health, financial supports, and community supports. Examples include referrals and connections to our COVID-19 centers of excellence, as well as other post-COVID clinics across New York City, diagnostic testing, primary care referrals, virtual support group, support for accessing paid sick leave, as well as educational resources related to pacing and energy conservation so that people are able to get through their day-to-day. We know that long COVID can look different for each individual, and for that reason, people will be able to choose the resources that are most relevant to them through the Aftercare program. We came up with our initial set of resources to offer based on our conversations with advocates in the field of long COVID, many of whom are patients themselves, as well as other local stakeholders in this area. But we recognize that this is an active and emerging area of ongoing research. As we learn more about long COVID, what it entails, what to expect, how people are affected, and what the best treatments are, we're continuing to enhance and personalize the range of resources that we're able to offer individuals who are living with long COVID. Aftercare and its resources are just one more step in our move toward a fair recovery for all New Yorkers so that we can deliver support to the communities that have been most affected by COVID-19. Thank you very much for your time, and I'm going to pass it back to you, Mr. Mayor.
Thank you very much, Dr. Johnson. And look, everyone, this is such an important initiative. I thank Dr. Johnson and everyone at Test and Trace for this really important work. Look, we got to be there for people. And we're still learning a lot about COVID, but the important thing is to recognize a lot of New Yorkers still suffering. We can help them. We will help them, regardless of ability to pay, regardless of documentation status. Very important to say that. This is, look, Test and Trace is part of Health and Hospitals, and this has been absolutely the credo of Health and Hospitals all along, here to help New Yorkers no matter what. So we're going to be there for folks as we move forward. And look, the good news, of course, is we continue to beat the variants, beat COVID with mass amounts of vaccination. We continue to take real steps towards a recovery. But as we do that, as we focus on a recovery for all of us, we've got to remember who is still suffering from COVID and stay by them no matter what it takes, and that's what we're going to do. Okay, now, I said there was some things today to highlight. And obviously very good news in the state budget, very good news on the continued vaccination levels going up and up and up. Very good news seeing our cultural institutions come back, our live performances come back, a lot of good news. Before I go to the indicators for today, I've got some more good news because even though it's still spring, summer is just around the corner. You can start to feel it. And so, I'm very, very pleased to announce that this summer, all 8 New York City public beaches will be open and will be open on time on Memorial Day weekend starting Saturday, May 29th. And 48 outdoor public pools will be open after the last day of school. That next day, or a few days later, Saturday, the 26th of June, Saturday the 26th of June, 48 public pools will be open, outdoor pools. I'll note that 5 of our outdoor pools are undergoing major rehab, so they will not be open, but the other 48 will be on time. We're going back to the schedule that we had for years and years, and that is a very good sign. Look, last year we had to delay the openings with public beaches. We had to limit the number of outdoor public pools. This year we get to do what is great for the families of this city, the kids of this city, have them all open. It's outdoors. It's exactly where we want people to be. It's a great way for the families in New York City to spend their summer. Now, we're going to do it the right way, which means, yes, there will be health and safety measures in place. There will be smart restrictions. There'll be smart rules whenever possible. Outside the water, of course, we want people to keep their masks on, et cetera. But it's going to be a wonderful summer in New York City. Lots of outdoor activities, outdoor pools, beaches, cultural events. This summer, New York City is going to come alive. This is going to be crucial to a recovery for all of us. And we're going to have a safe summer, and we're going to have a fun summer. And this is your reminder that you can do both at the same time. So I'm going to use my whole wingspan here. This means summer's coming, public beaches, public pools, but we're going to do it the safe way. A little bit of social distancing never hurt anyone. So good news ahead. Now, let's talk about the indicators for today. Number one, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 238 patients. Confirmed positivity level, 58.61%. Hospitalization rate, well, we don't have this number today because we normally get it from the state dashboard, and it has not been updated because of some technical issues, so we'll have that for you tomorrow. Number two, new reported cases on a 7-day average. Today's report, 2,991 cases. Number three, percentage of people testing positive citywide for COVID-19. Today's report on a 7-day rolling average, 6.52%. I'm going to say a few words in Spanish, and I'm going to go back to a topic that everyone cares about, the fact that the beaches and pools will be opening on time. Los neoyorquinos están listos para pasarla bien después de un año difícil. Buenas noticias. Las playas y las piscinas al aire libre de la ciudad van a abrir según el programa previsto con medidas de seguridad. Cuantas más personas se vacunen, más seguro será nuestro verano. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
Hi all, we'll now begin our Q&A. With us today is Dr. Amanda Johnson, Commissioner Choksi, Senior Advisor Dr. Jay Varma, Parks Commissioner Mitchell Silver, and Health and Hospital CEO Dr. Mitchell Katz. With that, we'll go to Juliet from 1010 Wins.
Yes, good morning, Mr. Mayor. Good morning, all. How are you today?
It's a good morning, Juliet. I'm doing great. How about you?
Yes, I'm fine. Thank you. So I wanted to ask you about this tourist who was shot yesterday. The police commissioner expressed outrage about a 5-year-old shot, innocent bystanders being shot. Yet I don't hear you talking about this, and why not? And why aren't you going to these neighborhoods to be supportive and to say this won't be tolerated?
Juliet, it clearly won't be tolerated because for years now we have been changing the whole reality of how we address crime and violence. We had a horrible disruption last year with a perfect storm of COVID, but NYPD is out there doing great work, more gun arrests than we've had in a quarter century. So of course, we condemn all violence, but the best way to address violence is by getting guns off the street, which NYPD is doing, by working with communities more closely, and that's what our police reform is all about, deepening the bond between NYPD and community, and I know that's going to have a huge impact. Go ahead, Juliet.
Okay, I understand that, but people are afraid, and you're advocating recovery when this is scaring people. You could be walking down the street and minding your own business and get shot, and this is happening in neighborhoods that are actually hardest hit by crime in the pandemic. So what are you doing about that?
Juliet, again, I've talked to New Yorkers all over the city. They are focused on this city coming back. I do not believe New Yorkers live in fear. It's just not who we are. I believe there's some real issues we have to address. I believe we've seen a serious uptick in gun violence that has to be addressed. It's going to be addressed. It is being addressed by more gun arrests, by deeper work with communities, more use of and more support for the Cure Violence movement and the crisis management system. We've been talking about these investments and these changes for months now, and we're doing it. So I think people see these actions and they know that continued help is coming. But New Yorkers don't live in fear. They keep moving forward. I really believe that. I've felt that my whole life here. Go ahead.
Next is Katie from the Wall Street Journal.
Good morning, Mayor de Blasio. How are you doing?
I'm doing okay, Katie. How are you?
Well, you know, excited about the beaches opening up on time. My question for you is about actually after the summer, looking ahead. Can you guarantee that every New York City public school next year will be open for 5 days of in-person learning?
Based on what we know now, absolutely. I'm going to put a little bit of asterisks, and I think we've all been humbled by COVID, that there's things we don't know and things that change beyond anyone's expectation. But I feel very confident based on what we know now, Katie. We're going to have 5 million people, 5 million adults vaccinated by June, and then we're going to just keep going. I will not be surprised by September if that number is closer to 6 million. The measures we put in place in the schools have absolutely worked. Everyone sees it. Parents want to come back. Yeah, we're going to be open 5 days a week for every kid who wants to be in school. Go ahead, Katie.
Thanks. And I guess bringing it back to summer, I know last summer there were restrictions on the beach, obviously social distancing measures, I think a mask mandate. Will there be those rules again this summer, or will there be some sort of change to the rules? Will people have to, continue to wear masks on the beach or whatever they did last summer?
Look, I think things are evolving, Katie. Obviously, as more and more people get vaccinated, and I do think that's going to start to drive down the case count for sure. I won't be surprised if over the course of the summer there's ways of doing things differently and giving people a little more freedom. But look, the rules in place, last I've heard, certainly the rules in place that the state set for last summer continue. I think that's smart for now. But we still have a ways to go until beaches and pools open.